what we're interested in knowing is essentially which patients are most likely to benefit from more versus less intensive therapy. And there's kind of two components to that. One is this therapy actually more effective, or is it effective? And the gold standard for testing that is a randomized trial. But the other component is the specific individual in front of us and their characteristics. So even an effective treatment can look ineffective if not given to the proper patient, right? So what we're trying to do is come up with a different method and approach that makes a little bit more mathematical sense, if you will, than historical standards. So the idea that most people would be familiar with is just staging. They often would want to know what stage is my cancer. And staging has an interesting history to it, but essentially it's used for a couple different purposes. One is to try to get a sense of how extensive or advanced is this cancer sitting in front of us, and should we do more limited treatment, maybe one modality like surgery or radiation, or is it more advanced where surgery might be off the table because you can't take it out. So in those, people typically know they go from 1 to 4, with 4 being quite advanced, and so on.